Welcome to this fantastic webinar on erectile dysfunction hosted by Coloplast. I want to welcome everyone that's live with us today. This is your opportunity to engage with me one-on-one, ask your questions that you may have about anything related to male sexual medicine. For those of us that are joining us on a recorded version at your leisure, please feel free to post your questions. I will have this video up in multiple different places as well as Coloplast. In order to find this video, go to kapadiamd.com. That's my personal website, and we'll have an opportunity for you to post a question there if you do have one. Our goal today is, as it says on the slide, to educate men and their partners about ED treatment options. In fact, I have a very simple goal here, and that is for you to understand what erectile dysfunction is. If you can take that away from this conversation, then understanding treatments makes it a whole lot easier. You see more information in order to scan a QR code. It's listed right there. Before we get started, just a brief word about me. My name is Akash Kapadia. I am a urologist, originally from Birmingham, Alabama. I grew up in the South. I completed my medical school at UAB in Birmingham. Then I went on to complete my training in urology on the West Coast. I did a residency at the Oregon Health and Science University in Portland, Oregon, followed by a great fellowship in male sexual medicine and male infertility in Seattle, Washington. After my training, I find myself back in the South, and I'm excited to be in this area and practicing in the Atlanta area as part of Wellstar's urology team running the men's health division. Once again, on this slide, I want to point out that our goal is to educate you on ED and treatment options, but just take away what ED is, and you will understand everything about the treatments and the fact that ED is 100% treatable. Agenda here talks about the hard facts of erectile dysfunction. I hope there's no pun intended here. But we'll talk about what ED is, the causes of ED, and what it means for your general health. We'll also talk about FDA-approved treatment options for erectile dysfunction. Now, this is important. There are 5 FDA-approved treatments for erectile dysfunction. It's just as important to know that there are some non-FDA-approved treatments that are out there that a lot of folks will come across, and it's one of those things that I would like to share with you. So that you obtain the treatment that is FDA approved. We'll finish with an educator video followed by some questions and answers if we have any. So definitions. What is ED? ED is the consistent inability to sustain an erection that is satisfactory for sexual intercourse. Now this is for the man himself or his partner. Now this is a spectrum. ED could mean a mild version where your erections are just weak, or that you're having a difficulty maintaining your erections. But it could also mean that you have a total inability to have erections at all, and this could be going on for years. So it really is a spectrum. And some facts about ED. So approximately 30 million men in the US suffer from ED. That is a whole lot of men. Now, this slide says up to 25% of men over 65 experience some ED, but the truth is really that number is closer to 40 to 50% of men. So that, once again, is a high number of men. I have one more disagreement on this slide. It says ED is not normal, and it is not by no means inevitable. Philosophically and theoretically and from a scientific standpoint, we tend to believe that ED is inevitable for all men if you live long enough. And I'll explain how ED works or how erections work in order for you to understand that. But as we age, ED becomes inevitable. We were not designed to have sex until the day we die. And the final point here is that in almost every case, ED can be treated. And we will talk about all those treatment options, and I'll help you understand what the treatments are. So before we talk about the causes of ED, let's try to understand erections and what happens when those erections fail. So I'm going to skip a few slides here. We'll come back to these the causes and risk factors for ED. All right, here we go. So how does an erection occur? Look at the picture on the right-hand side here. You see a barrel here with almost a face-like structure. Your penis is essentially a battery-powered hydraulic chamber. In fact, you have two hydraulic cylinders right next to each other, side by side, and those are sort of the eyes of that picture there, of that face. Those are your erectile bodies. For the lack of better terms, these are inflatable tire tubes. And I mentioned these are sort of the battery-powered hydraulic cylinders. The battery is the nerves, the stimulation that comes from the brain, the nerve output that comes from the brain that goes all the way down to the penile nerves, causing an erection. So that is your battery. What that battery does is it stimulates increase in blood flow, and it does so by making the arteries of the penis very, very large so the blood rushes into the penis, increasing that inflow into that hydraulic chamber. Well, the hydraulic chamber also has an outflow mechanism, and those are your veins. And essentially, when you have that battery generator working, the inflow goes way up and the outflow gets closed off completely. And that's how you generate and maintain a high pressure erection, by filling the cylinders to their maximum capacity. So how does ED happen then? Again, let's skip here for a second. And so this again goes to that same idea. So this is how erections happen. So how does ED happen? Now remember, we talked about 3 critical steps in order to get an erection. 1 is the battery input, or the nerves. 2, the increase in inflow of blood that happens into the penis. And 3, the closure of the valve system that prevents leak of fluid or blood. When one or multiple things go wrong during that process, that's how ED happens. And I mentioned earlier that aging is a big risk factor. The point here is, as your body goes through normal wear and tear, one of those systems is bound to fail, just like in a tire tube that's worn out. So now let's run back to causes of ED. All right, back to that slide. So let's now focus on the few causes listed down below here. It says ED can be caused by physical disorders such as spinal cord injury. So think back to that battery. If there's damage to those nerves in the battery, well, guess what? There will be failure of erections. Second point here, disease. Things like diabetes or heart disease. And we'll talk about diabetes in a little more detail. But these diseases or conditions affect the nerves and the blood flow into the penis. An operation. If you're a man that's a prostate cancer survivor and have had a prostatectomy, well, guess what? There's been damage to the nerves that cause erections, and that's how ED happens in you. Substances such as tobacco, drugs, alcohol, or medications, all in combination affect the blood flow into the penis. Now, it is also true that ED has been shown to be a marker for cardiovascular disease. And the simple way to think about this is that if there is a blood flow issue, and if I were to tell you that the penile arteries are about half the size of your heart arteries, you can understand that a disease would set in more quickly into the penis, followed by your heart. So that's why it's a known marker for heart disease. And what I would say to you is that, and this is a takeaway for this slide, is keep your regular checkups with your doctor and make sure you're getting the regular recommended blood work in order to diagnose heart disease early. Okay, risk factors for ED. Now this slide says up front, aging, and I agree 100%. Aging is a big risk factor for ED. If we didn't get older, we likely wouldn't get ED. But it's true that some men get ED sooner than other men. And that is likely because of a combination of chronic diseases, medications, or lifestyle things. So things like hypertension. Hypertension causes scarring into the blood vessels that are important in increasing flow into the penis, and that's how you get ED because of that. Now, diabetes is an important risk factor. It actually affects the nerves of the penis as well as the inflow system of the penis, causing ED. Depression and medications related to depression can also cause ED, as well as heart disease, as we talked about. Now, interestingly, medications for high blood pressure actually cause your valvular system to leak. And that's how you can get ED because of those medications, including thiazide diuretics, as well as beta blockers. It's also known that smoking and alcohol are big risk factors for ED. Once again, I'm not going to belabor the point, but I think you understand that aging is a risk factor for the simple reason that there is a significant wear and tear that we go through in our lifetime. Diabetes is one of the biggest risk factors, as I explained. The nerve damage that happens to several structures in the body, including your peripheral nerves in your feet and your hands, your kidney function, well, it can also impact the nerves of the penis, causing erections. And once again, hypertension has also been known to be a significant risk factor for ED. Here are some hard facts about the risks of each of these conditions. Once again, as you notice, diabetes is a big one. And so if you have diabetes, my only recommendation to you is to fight it like your mortal enemy and get good glycemic control, as that can prevent further progression of ED. Prostate cancer is a risk factor, as we talked about. During a radical prostatectomy, the nerves that cause erection can be damaged either temporarily or permanently during the surgery, resulting in ED. And once again, smoking, as well as several medications, are implicated in ED for the very obvious reasons of affecting one or two of the three systems that I mentioned. We've already looked at this slide. We understand how erections happen, and we also understand how ED happens now. It's a failure of one of the three items, or all three of them. So let's now jump to treatment options. There are 5 FDA-approved treatment options, and I mentioned this earlier, and I'll point out once again, do not choose non-FDA-approved treatment at this time. There are some investigational treatments that are out there, and our guidelines and the Sexual Medicine Society of North America states very clearly that if you choose one of those treatments, you should not be paying out of pocket. You should be part of a clinical trial in order to evaluate their efficacy. So let's focus on the 5 FDA-approved treatments. Number 1, I think most of us are familiar with pills. They're called the PDE5 inhibitors. There are 4 of them. There's only 3 on this slide. The 4th one is Stendra, so it's Viagra, Cialis, Levitra, and Stendra. They are essentially cousins of each other. They work almost identically in generating an erection. The way they work is essentially they increase inflow into the system. They cause your penile arteries to dilate, and that's how they overcome different forms of erectile dysfunction. It's true that they do not provide automatic erections, so you do have to go through a process of arousal and stimulation. It's also true that we find that in 20 to 30% of cases, they don't work, and that's likely because of a different problem in the system that can't be overcome by the increase in blood flow. It's also true that it takes about half an hour to 1 hour for those medications to work, so it means that you have to plan ahead and essentially add some planning in your plans of spontaneity. Side effects, if you've taken these pills, you're familiar with them. It can cause headaches at higher doses. It can cause flushing of the face, in some cases GI upset, and certain medications will also have an increased risk of back cramps or thigh cramps or muscle aches. Next up, and by the way, oral medications are a great way to start. I also find that penile injection therapy is also a fairly reliable treatment option. The way to think about this treatment is that instead of taking a pill that has to go through your entire system, we are now bypassing all the involved systems and going right to the target, which is the penis. With the use of a small needle, you inject a medication that is essentially a potent version of a Viagra or Cialis. It's a vasodilator that dilates the penile arteries, generating an erection. The advantage is that the onset can be quicker than pills. The disadvantages, and I can't emphasize this enough, is the fact that you have to stick a needle into the penis. For some couples and some men, it's not a big deal. For a lot of couples, that takes away the fun of sex. It takes away the spontaneity, and it requires planning. And that falls under the disadvantages of this treatment. I think it's a great treatment if it's the right treatment for you. It does mean that some of these medications need to be refrigerated, so you do have to plan accordingly and carry a cooler with you if you are traveling and things like that. So keeping those in mind, I think it's a great treatment option. Other disadvantages, there is the risk of having an erection that lasts for too long. That condition is called priapism. Possible pain at the site of the injection, some bruising, a rash sensitivity, or scar tissue formation in the penis. And this is one that I would like to sort of develop a little bit more. Penile fibrosis, another term for that when it's associated with deformity or curvature, is called Peyronie's disease. Some men, a small percentage of men with use of injections can develop this scar tissue disease called Peyronie's disease. The next two treatments, in all honesty, I don't like using alone. They are less effective than the first two treatment options that I offer. Vacuum erection devices. The way this one works is simply by generating negative pressure at the base of the penis, pulling blood into the penis. In the advantages, it says can be used with other therapies, and that's really how I like to use it. I don't like it as a solo therapy. I think it goes well with another form of therapy, such as pills or injections. It can be effective, and it's not as risky. It's less invasive from that standpoint. The disadvantages are that, the bottom real life scenario is that as soon as you take the vacuum erection device off, your erection can go away. So that's what makes it not a great solo therapy. Other things, it can leave bruising on the skin. It can lead to compression injuries if used for longer periods. But it tends to be an inconsistent form of treatment. The fourth treatment is insertable drugs or urethral suppositories. These are essentially similar to injections. However, they are placed into the urethra and then the medication is absorbed and disseminated into the penile tissue. I don't see this as a great treatment option because of one, cost, and two, once again, lack of reliability. And this is the theme that we run into when it comes to the first four treatment options that we mentioned. There is that lack of reliability, whether right up front or as you seek that treatment further and further. That's what drives couples away from those treatments. It's the lack of reliability. And not to mention the lack of spontaneity when it comes to intimacy. That brings us to our fifth FDA-approved treatment. In general terms, we are talking about a penile implant here. It comes in two forms: malleable penile implants, and on the next slide, as you see, inflatable penile implants. Once again, FDA-approved treatment. This is the solution that's the one and done solution. It's the one that gives you reliability and reintroduces spontaneity back into your intimacy. This is an outpatient procedure. You go home the same day. It takes about an hour to do, with a fairly brisk recovery period, and then ready for use in about 4 to 6 weeks. This is a treatment that essentially allows you to gain that reliability back in your lives. It is a good option for men that have a variety of health conditions. If you have limited dexterity, that's really the only time that I would recommend a malleable penile implant compared to an inflatable penile implant. The way to think about these two is that one is sort of the Toyota Corolla, the other is the Mercedes. And in my experience, most men, a majority of men, will qualify for an inflatable penile implant. The reason I like the inflatable penile implant for most of my patients is that it provides you with that natural appearance of the penis when you're in the deflated state, and a very natural and hard erection when you're in that inflated state. So this device, once again, is completely private, natural, concealed, and doesn't change anything about you. You are exactly the same man that you were, but now you've got the ability to get an erection when you want, however long you want. And if you'll think back to that picture that we drew, the face, these devices have three components to them. The primary component is the cylinders. The cylinders are customized to your size and placed in those exact same areas that fill with blood. So nothing is removed from you. We're simply sizing you with these cylinders, and we're just replacing the hydraulic chambers. The second component is a pump that sits inside the scrotum. And the third component is actually a fluid tank, because now the erections are driven by normal saline. And we're simply transferring fluid back and forth in order to give you a reliable erection each and every time. You can read everything else on this slide, but it is completely concealed. Natural look when you're down, a really firm and hard penis when you're up. It doesn't change the sensitivity of the penis, the ability to climax or ejaculate. We're simply giving you erections when you want, however long you want. With any surgery, there are risks, and these are the risks for this particular surgery. There is about a 1% risk in most patients, and in certain patients with health conditions, there is a slightly higher risk of infection, no different from any prosthetic devices such as a hip or knee replacement. And this is important to mention, it would make your natural erections not come back, and that's self-explanatory, but when men choose this option, they're already not getting their natural erections, but it's important to mention that. Erosion or wearing away of the tissue next to the implant, migration of the device, pain or device malfunction. This device lasts for about 10 to 12 years, and the joke in my clinic is the first men to be back in my clinic are the ones that have failed their device because they're ready to get the next one. We're going to watch a quick video on the penile implant. Hopefully I can do this right. Here we go. So I'll walk you through the animation here. You can see the three components. You've got the two cylinders inside the penis size to your natural size. There it is. And then the pump down in the scrotum that you are able to use to inflate. And the pump exists in its natural space away from the testicles. And there it is. You can see the transmission of fluid from the reservoir directly into the cylinders, creating a nice and firm erection for sex. And with the other hand here, you're going to press a button, squeeze the penis, get all that fluid transferred from the cylinders back into that reservoir tank that sits inside the belly. And now you have a natural appearance to the penis. Let's go back to the slides. So this is a very important slide, and perhaps one of the most important slides of this conversation. The most common question I get is my implant covered by my insurance company? And I'm here to tell you that most insurance plans, including Medicare, which is perhaps the best coverage, would cover the procedure. That's often interesting because a lot of the medications and injections are not covered by insurance, but implants are covered because they are FDA approved. If you see me in the office, I would have my authorization specialist check for you with your insurance, and I'll also give you the code to check for yourself to see if this implant is covered. If it is a situation where your health plan does not cover it, we can certainly talk about out-of-pocket costs when it comes to implants. Now, I've got a question that's waiting in the waiting room. I'll certainly get to it in just a moment after we're done with these slides, and we can have a detailed conversation about that. To learn more about ED treatments, implants, whatever have you, go to www.coloplastmenshealth.com. If you are a Spanish speaker, visit www.labombita.com to answer any of your questions. We have one short video to watch, and after that, I would be delighted to answer any questions.
Hi, my name is Stan Rydelic, and I'm 61 years old, and I live in South Carolina.
I'm Teresa Rydelic. I'm 60 years old, and I met this gentleman when I was 15 years old, and we've been together ever since.
I've been married to my wife, Teresa, we've been debating this, 39 years. 39 years. 39 years.
October.
39 years of bliss. About three and a half years ago, I ended up getting ill. I thought I had the flu. It turned out that I had complete liver failure, and so unfortunately, or fortunately, I had to have a liver transplant. As part of the procedure to nourish my liver, I found out what they did is they rerouted some of my blood flow, and so I ended up with a condition called arterial insufficiency, which basically means that the lower part of my body had insufficient blood flow. After I had my liver transplant and I was feeling well again, and then I found out that things were not happening romantically. It was kind of a surprise. So what I did was I asked my general practitioner, and so he immediately says, well, you know what? All you need is some Viagra. So what he did was he gave me a prescription for Viagra. I went home. I remember that evening, I was thinking, oh, how wonderful, Viagra. Of course, it's going to be a great evening. So what I did is I put some music on, poured some wine for my wife, lit some candles, and guess what? Nothing happened. So I went back, and and every time we're going in, it's just like it's 2 weeks or so between appointments, and it's still like nothing's happening, and you start to really get very discouraged. So the doctor gave me a choice. He says we could use vacuum erection devices, he says, or we can also use an injection. So I said, well, let's try the vacuum thing first. That was horrifying. Well, first of all, in my opinion, it was horrifying. It didn't really work. So that was like a one-time shot. And then we tried it was Trimix that I tried. And so I thought that was going to be great. Went home, and again, since there was a tiny bit of success, I thought this was going to be a great evening. So you try to get all romantic, and then you say, oh, excuse me, honey, I have to go into the bathroom and inject my penis with Trimix. I did everything that I could, and quite honestly, I had never even heard of a penile implant. And so when this doctor I went to, he was a young gun, kind of like, cutting edge, and he says, well, I think the only thing that we could do, he says, to really guarantee that you can get an erection is a penile implant. So Teresa was a part of the process. She came to the doctor's office with me, and what we did is we had the discussion about it in penile implant, and she said, look, if it means that much to you, she goes, I want you back how you were. I want you happy. A couple things came up. The first one that I worried about was the procedure, a painful procedure. And quite honestly, I was told, and after experiencing it, it's an outpatient procedure. It takes less than an hour, in many cases a half an hour or less. Another thing that concerned me also, and this one's going to sound really, really very strange, but I really worried that I would have the desire to have sex.
Well, it's kind of ironic because that's exactly how I felt. I felt like, well, he's going to get this implant. We hadn't had sex in so long. Maybe that chapter's over. And I think that a lot of women worry that they're not going to be ready for this new adventure like they were. And it actually has been a renewal of our relationship in one area. And so I'm glad. I'm just glad it's freeing. It's taken on where we can be spontaneous, just so different than years before.
There was a romance.
Yeah.
There was a spark that was put back that we didn't know went out. The thing that's really, I think, been wonderful with an implant, with the implant, which I don't consider I have an implant anymore. It's just it's a part of me.
Right.
There's no. Well, first of all, from the standpoint, if you look at me, if you saw me in the shower or whatever, you cannot tell that I've had an implant at all. And then also from the other standpoint is you have complete spontaneity. There is never anything where you have to say, okay, you know what, I'm going to take a pill and wait a half an hour for it to happen. If you're in the mood, you're in the mood.
Right.
And you know, I mean, it turns back the clock. I mean, I honestly feel like we're in our 20s or 30s.
Since the implant, there's a confidence there that is actually very sexy. And that confidence is something that I think the implant did for us. And I don't worry that it was me, you know, that maybe I wasn't something that he was needing. No, we're perfect for one another, and now we have back our love life. If I could give some advice to someone dealing with this, a couple dealing with this, I would say talk to one another, be honest and open and loving, because the answer may be no. The answer may be, no, I don't want to do this, and it may be, I've been thinking about this. So I think communication is the key.
If I could give a piece of advice to anyone suffering from erectile dysfunction, it is the fact that you have one life, and you have the choice to choose how you live your life and at what level of quality you live your life. So if you're suffering with something like erectile dysfunction, that's fine, you can live with it, but you don't have to. It's something that is so easily fixed, and you could have the quality back in your life that makes you a whole person again.
Okay, that was a great video. Let's jump back to our discussion. This is the perfect time here. This is my favorite time. I get to answer some